Mm-hmm.
This is all easy-ish. It's the ones that you don't have time on tables. It's the ones that you don't work out until after they maul you.
Yeah.
They're the ones that, so we don't let his head out, but we let him see out. Now I have to get the leg. Alright. As long as he doesn't get his teeth in it.
Yeah.
His teeth will still go through this sac if you're not careful. So I'm holding his head.
Mm-hmm.
Now I can let go of his head and I'll do that. So you don't panic.
Yeah.
And just make sure you know where. No, let me do this. I'm getting the Velcro. Just make sure you know where the teeth are.
Yeah.
There you go. So that's just a matter of just watch, because he will try to bite through that. Except I might give him a full dose, which is a little bit. And I'll do this with that method. That's it. Okay. So I'll do this so you see it. Normally I would give him the whole dose. But
yeah.
Right. So that. I'll take him out. So that now releases. Let's make sure. I'm just gently take it out. Sometimes I follow it with my hand.
Yeah.
Okay, there you go. Good talk.
It's important that when an aggressive animal arrives at the clinic that you update their file with a note that says they are aggressive. This is important for the future reference when the patient next comes to the clinic. In order to do this, go to the patient's file, select notes/important information and add a note, e.g. the patient is aggressive, handle with care, or patient requires a muzzle, etc. Due to it being the first visit for this particular case, I needed to update its file to state that it is aggressive and will require a muzzle, cat bag, or crust cage depending on the treatment it needs. This is needed to be completed for future consults and the safety of the future nurses and vets whom will handle this patient. When the patient is being hospitalised at the clinic, even if only for a very short period of time, it is important to write on the patient's cage card that they are aggressive for the safety of those working in the clinic, including those not directly working with the patient. A warning sign was also used in this case to warn those in the clinic, as well as writing that the patient is aggressive on the patient's hospital cage card. This was to ensure that the other nurses and the vet were aware of which cat in that same day was aggressive. 2 cats were in the surgery on the same day, both by the same owners. Before pre-medication was administered, I was unaware that this cat was aggressive. The owners did not state that the cat would possibly be aggressive, as to their knowledge it had never been aggressive before. The cat began showing signs of aggression when pre-med was being administered upon arrival to the clinic for a routine desexing, castration, surgery and vaccination. The cat required a towel and 2 people to restrain, but continued to show aggression throughout this process, such as hissing, vocalization, scratching and biting attempts. This only occurred when the nurse myself tried to administer the medication under the skin via a needle. Although the cat was showing aggression at this time, he was able to be handled safely and without trouble when returning or taking out of the cage. It was only when drugs were to be administered or hair to be clipped that the cat began to be aggressive. Although this was the case, safe and correct handling techniques were implemented as to avoid being bitten or scratched if the cat was to suddenly become aggressive when transferring the cage to the surgical table. During periods when the cat was not being handled, the cat was left in its own cage with a towel over the top as short-term management of the aggression. This helped keep the patient quiet and calm in new surroundings. Possible reasons for the cat's aggression is that the cat is a farm/outside cat. With minimal handling by the owner. The cat was an entire male and was also in a new, uncomfortable, scary environment, making anxiety and nervousness a possible reason for the cat's aggression. Handling of this cat was kept to a minimum as not to stress it out. It was advised not to handle the cat often and only unless it needed to be handled. The cat was kept in the cage. It came in from familiarity and comfort and placed next to its friend, the cat also from the same owner, so that they could see and hear each other, keeping them both calm and relaxed. It was discussed with my supervisor that this was a suitable management technique. It was also decided between both the nurses and the veterinarian that the cat bag would be needed when the patient was to be placed under anaesthetic via an intravenous injection. Other options such as a cross cage or top loading cage were discussed, but it was decided that we would try a cat bag first as the cat was able to be transferred safely between cages, etc. Due to the nature of the cat's visit to the clinic, long-term management was not needed at the clinic, although the nurse myself did discuss with the owner upon discharge that the cat was aggressive and that a possible solution for at home was to spend more time handling and interacting with the cat to make future visits to the hospital less stressful for both cat, staff and owners. We do understand that the patient is a farm cat, so handling is already minimal. Possible long-term options were discussed with the supervisor and the vet if it was to be required for future visits and other patients at the clinic of a similar aggression. One of those options including sedation for easy long-term treatment/hospitalisation and for the safety of those handling the patient regularly at the clinic. This cat was placed under anaesthetic for surgery using a cat bag as shown and the procedure completed. Immediately after surgery, the patient was returned to the cage to recover completely. It was decided by the veterinarian and the nurse that the patient was to be sent home an hour later or as soon as possible to reduce the need for handling by the nurses and the vets. The owners agreed and decided that it would be better if they took it home and they handled it from there on. During this short period of time between the end of surgery and pickup, the patient was still recovering from anaesthetic, so was asleep/resting. Upon consideration, this can be taken as a long-term management in alignment with the use of sedatives if the patient was to be kept for a longer period of time. Upon consideration and discussion with my supervisor, it was discussed that future patients with the same or higher aggression should be placed in a top-loading cage for safer and easier access. Other options similar to that of a cat bag include a crush cage. Both achieve the same purpose of patient restraint with minimal chance of being bitten or scratched. Afterwards, all equipment was cleaned and disposed of. This includes the placing of syringes and needles in a sharps container. We have one in every room of our clinic, and the washing of towels. The surgical kits were also cleaned and sterilised post-surgery.